So if you're dealing with psoriasis, you've probably been told your whole life that it's a skin problem. But what if I told you the creams, the shampoos, even the injections, what if they're all aimed at the wrong target? Today we're going to look at a completely different map for psoriasis, one that suggests the real problem isn't on your skin at all. Okay, let's just jump right in with this. Psoriasis is not a cream deficiency. It's not a shampoo deficiency either. You know that one sentence? It pretty much challenges decades of how we've treated this condition. And it forces us to ask a much, much deeper question. What are we actually treating here? For so many of you, the journey with psoriasis follows this script that is just, well, it's frustratingly familiar, isn't it? It's a cycle of appointments and prescriptions that just seems to lead you right back where you started. Think about it. Does this sound familiar? You walk into the doctor's office, they take a quick look at the plaques on your elbows or your scalp. The prescription is almost always the same. A steroid cream, maybe a tar shampoo. If it's really bad, you might get an oral immunosuppressant or even one of those powerful biologic injections. And it all ends with that same old line. It's incurable, but we can manage it. You're just stuck in this loop, right? Just managing the symptoms. But what if we've been looking at the wrong map this whole time? This is where things get really interesting. The new thinking frames psoriasis not as a skin disease, but as a systemic, whole-body immune issue that just happens to show up on your skin. And this slide really breaks down the two different ways of thinking about this. The conventional approach is all about managing the flames that you can see, the redness, the plaques, using creams to suppress them. The other approach, it's about cooling the fire from the inside out. It's about retraining your immune system, getting to the root cause, and supporting your entire body. It's a huge shift in perspective. Okay, so here's the bottom line. Psoriasis is an immune misfire. Think of it like friendly fire inside your own body. Your own defense soldiers, these things called T cells, they get bad orders from these messenger signals called IL-17 and IL-23. And this confusion makes them attack your own skin cells by mistake. It's an internal communication problem. And guess what? A ton of new science is showing that this is all deeply connected to what's happening in your gut. Now, this isn't just theory. Let me tell you a powerful story about a doctor who wasn't just treating psoriasis. She was living with a severe case of it herself, and her journey completely changed everything. For years, she was stuck in that same old cycle. Flare, suppress, flare, suppress. She was on all the standard drugs, but they came at a cost. Her liver enzymes were climbing, and her kidneys were showing strain. Then she discovered a different path, a carefully monitored high-dose vitamin D protocol. And over the next few months, something incredible happened. Her skin plaques started to soften. Her severity score just plummeted. And today, she's in clinical remission. And this really gets to the heart of this new way of thinking. You have to think of vitamin D not just as some vitamin for your bones. In this world, vitamin D is the king. It's a powerful hormone that's sitting at the control panel of your immune system. But here's the thing, and this is so important. A king can't win a war all by himself, right? He needs an army. Vitamin D requires a whole team of cofactors to do its job properly. Magnesium is absolutely essential to activate it. Vitamin K2 is the traffic cop that tells calcium to go into your bones and stay out of your arteries. B vitamins, selenium, zinc, they all have critical jobs. Just taking vitamin D alone is like sending your king into a huge battle without any of his soldiers. Okay, I know what you're probably thinking right now. Wait a minute. Isn't taking high doses of vitamin D dangerous? What about my kidneys? And look, that is an absolutely valid question. But we have to look at the whole picture when we talk about risk. To really understand this, let's look at another story. This is a 60-year-old woman with multiple sclerosis, another autoimmune disease. She'd been on seriously powerful immunosuppressant drugs for over 20 years, and her body was paying the price. When she came to the clinic, they tested her kidney function. There's this number called an eGFR, and for a healthy person, you want that to be up over 90. Hers, it was already in the mid-20s. That's serious chronic kidney disease territory. And get this, This was before she even started any vitamin D protocol. This was the damage from the disease itself and 2 decades of those heavy drugs. So then what happened? Well, after just 6 weeks on a properly monitored program with the vitamin D, the cofactors, diet changes, and hydration, her new labs came back. Her eGFR, it had climbed from the mid 20s into the mid 30s. Her kidneys were actually getting better. And that's the big takeaway here. When the body's entire system is supported correctly, we don't always have to make that terrible choice between controlling our symptoms and protecting our organs. The real risk so often comes from the years of uncontrolled inflammation and the very drugs that we use to try and suppress it. So this leads to the million-dollar question, right? If this approach can work so well, why on earth isn't it common knowledge? Why isn't your dermatologist talking about this? Well, the answer really lies in a systemic blind spot in our medical system. It really comes down to three main reasons. First, there's the training. Dermatologists are brilliant experts in skin lesions and pharmaceuticals, but not necessarily in immunonutrition. Second, you've got the guidelines. The standard vitamin D recommendations were designed to prevent bone diseases like rickets, not to calm down a complex autoimmune condition. And finally, there's just plain old fear. Doctors are rightly taught about the dangers of vitamin D toxicity, but often without the full context of how cofactors and careful lab monitoring create a safety net. And this is exactly why that standard advice you might have gotten, take 60,000 units once a week for a bit, why it so often does nothing. For a raging autoimmune condition, that kind of dose is like trying to light up an entire city with one tiny candle. You're just going to say, well, I guess electricity doesn't work. Okay, so what do you do with all of this information? The goal here isn't for you to run out and start experimenting on yourself. No. The goal is to empower you so you can walk into your doctor's office and start asking smarter questions. So here's a safe path forward. First, just ask. Ask your doctor for the data. What's my vitamin D level? How's my magnesium? Second, start making those lifestyle adjustments that we know support your immune system. Sensible sun exposure, a whole foods diet, managing your stress, and this is the big one. If this approach makes sense to you, seek out a clinician who's actually trained in these specific protocols. And please, I have to say this one more time. Do not start taking high doses of anything on your own. This has to be supervised by a professional. And that brings us to a really important point. To be crystal clear, this explainer, it is not medical advice. It's for educational purposes. Think of it like we're giving you a new, more detailed map to a hidden territory. But you still absolutely need an experienced, qualified guide to help you explore it safely. So we leave you with this one last thing to think about. Whenever a condition gets that label incurable, it's always worth asking yourself, what are we really managing here? Is the goal to restore the health of the entire system? Or is it just to silence the alarm bells, the symptoms on the surface? The answer to that question could change everything.